If you like our YouTube videos, make sure to check out our video subscription to access over 150 video courses. Check it out at allysafety.com.
When most of us think of hot summer days, we don't associate them with danger. Danger is supposed to be something that lurks in the shadows, unexpected, not obvious like the light of the sun. But between 2010 and 2020, there were 267 workplace heat illness deaths in the United States, and 40 of those were in California. In 2008, 6 California farm workers died from heat exposure in 1 year. These deaths prompted the state of California to pass the most stringent heat illness prevention laws of any state. Those who died were fathers and mothers, friends and family members, ranging from ages 17 to 64. The youngest was Maria Isabel Vasquez Jimenez, who collapsed in 95-degree heat while working in a vineyard not unlike this one. She was only 17 years old, was healthy, and was also unaware that she was 2 months pregnant. The nearest water cooler was a 10-minute walk away. Workers said the foreman didn't allow them long enough breaks to stop and get a drink. Maria collapsed from the heat and wasn't immediately taken to the hospital. By the time she was in a coma. Maria never left the hospital and died just 2 days later. Maria Jimenez's death sparked public outcry, and 500 farm workers carried 2 empty coffins, one for Maria and one for the baby, on a 50-mile march from the fields to Sacramento in protest, causing the entire state to rethink their approach to heat illness prevention. Maria's story is just one of many heat illness tragedies. The sad truth is, these deaths can be prevented by just 3 simple things: water, rest, and shade. I'm Rachel with Ally Safety. Today, I'll be walking you through heat illness prevention and response. Protecting ourselves from heat illnesses is critical to workplace safety, but it's also an essential life skill that can protect you both at home and at work. I encourage you to use this training as an opportunity to check your perspective on heat hazards so we can learn from the past and prevent tragedies in the future.
Most of us didn't grow up learning about the dangers of heat illnesses or how to recognize the warning signs. The surprising thing is, it doesn't need to be 100 degrees for someone to die from heat exposure. Whenever temperatures rise above 98.6 degrees Fahrenheit, our bodies can't cool themselves effectively and actually need help cooling down. Prevention is as simple as water, rest, and shade. It also helps to wear loose-fitting, light-colored clothing that's lightweight, hats, and also to know the weather conditions. That way you can take care of yourself before work and after work with healthy foods and lots of hydration to prepare for the next day. It's also important to know that everyone tolerates heat differently, and some medical conditions may cause you to struggle to handle heat exposure more than others. Personal risk factors include obesity, diabetes, high blood pressure, heart disease, a low level of physical fitness, pregnancy, or certain medications like diuretics, some psychiatric medications, or blood pressure medicines. Lifestyle also plays a big role. For example, if you drank alcohol recently or you use drugs like opiates, methamphetamines, or cocaine, you will also be at higher risk. Know your risk factors and tune into your body's signals of overheating so you can take steps to prevent heat illnesses. Let's look at one of the most critical aspects of heat illnesses that we don't often hear about: acclimatization. Early in spring and summer, during heat waves, and any time you're not used to working in the heat, you're at a high risk for heat-related illnesses. In fact, 3 out of 4 workers who die from heat-related causes die during their first week on the job. The reason is your body needs time to adjust to working in the heat. This adjustment phase is called acclimatization.
When you're acclimatized to warmer temperatures, your body is more efficient in operating in the heat. You'll sweat earlier in the day, sweat more overall, while losing fewer electrolytes. You'll also have increased blood flow to your skin, allowing your body to cool itself better. You'll be able to perform work with a lower core temperature and heart rate. All of this makes you more comfortable and cool in the heat. To acclimatize, you need to give your body time to adjust. Start by gradually increasing the amount of time you spend working in hot conditions over the first 1 to 2 weeks. For new workers, start with 1.5 hours to 2 hours on day 1 and then add 1.5 hours each day until you get to 8 hours on day 5. For those who have previous experience on the job, you can start at 4 hours and increase to 5 on day 2, 6.5 on day 3, and then 8 hours on day 4. While you're acclimatizing, drink plenty of water, eat regular meals to stay hydrated, and replace lost nutrients. This helps your body to adjust. If you take a break from working in the heat, like taking a vacation for about a week, you'll actually lose some of your acclimatization. So you'll need a few days to readjust. But don't worry, after 4 days of slowly increasing your workload, you should be back to normal. Support your body through the high-risk acclimatization phase. This is one of the most important things you can do to prevent heat illnesses. To prevent heat-related illnesses, you have to stay hydrated. Your body is 70% water and it cools itself by sweating, which uses up water. If you're thirsty, you're already dehydrated. So start hydrating before you're thirsty in the morning. During the day, drink more water than you think you need to and aim for drinking a quart every hour. In the evenings, drink extra water to help your body prepare for the next day. Drinks with electrolytes like sports drinks can help you to replace lost minerals, but avoid energy drinks and alcohol, since these can both leave you feeling dehydrated. Next, notice if you're showing early signs of dehydration and drink more. Dehydration symptoms include thirst, less frequent urination than normal, darker urine color, dry skin, tiredness, dizziness and/or feeling faint, and headaches. Employers are required to do their part by providing clean, cool drinking water that's easily accessible. There has to be enough water available for each person to drink 1 quart or more per hour. Your job is to take advantage of this and drink plenty of water. Stay hydrated to stay healthy. Access to shade and the ability to take breaks might not seem like a life-changing step, but it actually can be. Employers are required to do their part by providing access to shade that's close enough to the work area and can be used to cool down during breaks and meals. You need to take a 10-minute break every 2 hours in the shade to give your body time to cool down and recharge. This prevents heat illnesses effectively. There may be times when you need to take a break outside of the normal break times. This is hard to do when everyone else seems to be fine continuing to work, and most of us don't want to ask for special treatment. The thing to keep in mind is that everyone has different tolerances to heat, and your heat tolerance may not be the same day to day, depending on your health and activities outside of work. Preventing heat illnesses takes tuning into what our bodies are telling us and respecting the message. So take your breaks in the shade. Your supervisor should be monitoring you to make sure you aren't experiencing signs or symptoms of heat illnesses. If you are, stay in the shade, drink water, and cool down until the symptoms are gone.
The best way to prevent heat illnesses is to focus on prevention. But if prevention fails, you need to respond effectively. Heat illnesses can be serious medical conditions, but they don't look like other workplace emergencies. The signs are subtle and symptoms can change pretty quickly. Here are 2 conditions that you need to know about: heat exhaustion, which can be treated with first aid, and heat stroke, which is a life-threatening condition. First, heat exhaustion occurs when your body overheats and it can't cool itself. The symptoms are fatigue, weakness, dizziness, confusion, nausea, vomiting, headache, fainting, and heavy sweating. If you or someone else shows signs of heat exhaustion, here's what to do. Move the person to a cool, shaded area. Have them drink cool water or sports drinks. Have them loosen any tight clothing and use cool towels to help lower their body temperature. While they rest, monitor their symptoms until they're feeling back to normal. Anyone who's showing signs of heat exhaustion should not be left alone or sent home without first aid. Heat stroke, on the other hand, is a medical emergency. It occurs when the body's temperature rises rapidly and sweating stops. This is the biggest sign that the individual is experiencing heat stroke. Along with no sweating, watch out for these signs: hot, dry, red skin, a high body temperature above 103 degrees Fahrenheit or 39.4 degrees Celsius, rapid pulse, a throbbing headache, nausea, confusion, or unconsciousness. If you suspect someone has heat stroke, act fast because this is a medical emergency. Call emergency services or a supervisor immediately. Move the person to a cooler place like an air-conditioned vehicle or a shady area. Loosen tight clothing and fan them if possible. Apply cool, wet cloths to their body. Give them cool drinks like water or sports drinks, but do not give the person fluids if they're unconscious. Then stay with them until help arrives. Communication in emergencies is critical to get help when it's needed. There always needs to be an effective, reliable way to communicate to others. If you're not close enough to communicate to others by voice, use phones or radios. Just make sure you have a way to keep your devices powered and that there are no areas where you'll lose reception. When you're communicating about an emergency, keep your messages clear and direct so the person you're communicating with understands what you need from them. It's always best to get support and help on the way when it's needed. By recognizing the signs of heat exhaustion and heat stroke and knowing how to respond, we can treat symptoms with first aid before they become medical emergencies. If a medical emergency does occur, you'll know how to respond effectively. On days where the temperature reaches 95 degrees Fahrenheit or higher, high heat procedures need to be in place because the risk is serious. During high heat days, it's important to have someone checking in with you who will notice when something is wrong. The thing is, heat illnesses can come on very gradually, and the person who's experiencing them might not always recognize when they're in danger. High heat procedures are really simple. Think of them like a partnership between supervisors and employees that requires communication, checking in on each other, and having a plan if someone starts showing signs of heat illness. Start the day with a pre-shift meeting to review the high heat procedures and encourage everyone to drink plenty of water. Once work starts, have a way to communicate and maintain contact with your supervisor for things like getting more water delivered if needed, reporting incidents, or calling for help if someone gets seriously sick. That can be communication by voice if you're nearby, observation like line of sight, or electronic means like cell phones and radio where reception is available. A supervisor or their designee can observe 20 people at a time. More than that is just too much for one person. You can also use the buddy system and monitor one another, or arrange to have regular check-ins with anyone who's working alone nearby, and check in using a cell phone or radio. Then drink plenty of water throughout your work shift and encourage your coworkers to do so too. Once the temperature reaches 95 degrees or above in the day, you need to take a minimum 10-minute cool-down break every 2 hours. The 10 minutes does not include the time it takes to get to the break area. You'll need the full 10 minutes with shade to cool down and rehydrate. High heat days require a little extra vigilance, so take care of yourself first and check in with your coworkers so that everyone can stay healthy. You've now got the knowledge you need to prevent heat illnesses and to respond effectively if they do occur. Listen to your body, hydrate, take breaks in the shade, and look out for one another. Let's all work to prevent the tragedies of the past from occurring in the future. Thank you so much for watching. Take care and stay safe.
Hi, Rachel from Ally Safety here. If you enjoyed this video, make sure to check out the Ally Safety Toolbox Talk membership at allysafety.com. There you'll find an entire library of videos that are created to make safety entertaining. I'll see you there at allysafety.com.